Hello and welcome everyone to this session on inhalational anesthetic agents part 3. My name is Dr. Jhanvi and today we are going to go into the details of each and every inhalational anesthetic agent. Okay. So in the first two parts, we saw a lot about the mechanism of action of inhalational anesthetic agents. Then we saw how exactly are these inhalational anesthetic agents working on the brain, on the kidney, liver, heart. And also we saw a few of their properties about the factors that affect the uptake and distribution of inhalational anesthetic agents. And today we are going to go into the individual properties of each and every agent. Okay. Now, these are some of the agents that we will be discussing. And let's start off first with the colors of the vaporizers of each and every anesthetic agent. Okay. So when you look at the purple color vaporizer, this purple color vaporizer contains isoflurane. Yellow color vaporizer contains sevoflurane. Red color vaporizer contains halothane. And this vaporizer that you can see over here, the blue color one, it contains desflurane. Okay, so this is the color coding of the vaporizers. Now, why are vaporizers important? As we all know, these anesthetic agents that we have, all of them are present in the liquid form. Okay, from the liquid form, they need to be converted into the vapor form. So when they are converted from liquid to vapor form, what is the instrument that converts them? So the instrument that converts them is called as the vaporizer. All right. So this is what we need to know about the vaporizers. Now, one more question that is commonly asked in the exam is, which of these inhalational agents have a special vaporizer? Okay, so remember that desflurane has a special vaporizer. This desflurane vaporizer is called as Tech 6, and we will see ahead why desflurane needs a special vaporizer. All right. Okay. The next thing that we need to know is all the details about individual anesthetic agent. So first, let's discuss about halothane. All right. Halothane, very important agent, was used for a long period of time. Now it has gone a little bit out of vogue, but at one point it was one of the most common inhaled anesthetic agents that we were using. Okay. One very important quality about halothane is that it is a smooth muscle relaxant. It is a smooth muscle relaxant. Okay. So whenever you look at halothane in and how does it act? So when it works at the bronchi. It will basically, when you inhale halothane, it will cause smooth muscle relaxation of the bronchial smooth muscles, and you will get something which is called as bronchodilation. Okay. Now, this bronchodilation is very important for someone who has asthma. So, they used to say that in asthmatic patients, the inhalational agent of choice is halothane. And why is it the inhalational agent of choice? Because of the bronchodilatory properties that it has. But now for asthmatics, we prefer to use sevoflurane because halothane comes with its own side effects of causing arrhythmias, of causing inhibition of baroreceptor reflex. So all of those things. Okay. Now, the next thing, just like halothane dilates the bronchi, it also dilates the uterus. Okay. So, why does it dilate the uterus? Because as I told you before, it is a smooth muscle relaxant. So, halothane also causes dilation of the uterus. Okay. Now, this point is important in patients who are undergoing postpartum hemorrhage. Patients who are undergoing postpartum hemorrhage. Okay. In postpartum hemorrhage, you want that the uterus should contract. It should not relax, because if it relaxes, the bleeding will continue to happen from the place where the placenta was attached. Okay. So if my patient is having postpartum hemorrhage, the inhalational agent that I will definitely avoid is halothane, as it will continue to cause uterine relaxation. Okay. Another thing that you need to know is that there is also a converse of whatever we are talking. And what is that? Halothane is preferred in case of internal and external version. What is internal and external version? So basically, this used to be done previously, and they said that if the baby is suppose not having vertex as the presenting part. Okay. So if the baby suppose is in transverse lie and you want to make sure that you want to move the baby and get the vertex as the presenting part. Okay. So in that case, how will you relax the uterus? So in that case, we relax the uterus by giving halothane to the mother. Okay, so when you give halothane, it causes uterine muscle relaxation. Because of the uterine muscle relaxation, if you can move the baby, if you do it externally, it is called as external version. If you do it PV, then it is called as internal version. Okay, but this is not a very common thing that is done, so it is not a point that you should be mentioning first in your exam. The point that you can definitely mention is that halothane is avoided in PPH as it prevents the uterus from contracting. Okay. Another thing is that halothane is photosensitive. Whenever you expose it to light, it gets degraded. And that is why we keep halothane in amber colored bottles. All right. The preservatives that are present in halothane are nothing but thymol, so that it does not get degraded. Halothane is not flammable in nature, and this is one of the important properties of halothane, why it became quite famous. The previous before halothane, the agents that were coming like cyclopropane, ether, all of these were very flammable. So it was not very safe to use them, and halothane changed the game with this property. Okay. Now, also let's have a look at the bad points of halothane. So one bad point of halothane is that it causes arrhythmias. How does it cause arrhythmias? If this is the heart, on the heart, you have these receptors, sympathetic receptors. Okay. These are receptors for catecholamines. Now, if you have receptors for catecholamines over here, then what happens? So basically, your adrenaline, noradrenaline, these are the endogenous catecholamines that are released in the body. They will go and attach to these receptors, and they will cause their action on the heart, like tachycardia and sympathetic action on the heart. Okay. But if too many of these receptors are activated, if the catecholamines go in bulk and they go and activate many of these receptors, then it can lead to arrhythmias in the heart. Now, what halothane does is that it sensitizes these receptors. Okay, halothane will sensitize these receptors, catecholamine receptors, and make it easy for the catecholamines to act on the heart. And this leads to arrhythmias. And it is because of this bad point of halothane of causing arrhythmias that we don't prefer to use it anymore. Okay. Another bad point, as we already discussed, halothane causes uterine dilation, so we don't prefer it for postpartum hemorrhage. The next bad point is that halothane inhibits baroreceptor reflex. Halothane inhibits baroreceptor reflex. Okay. So in baroreceptor reflex, you have these bodies that are present in the carotid arch, and they help in regulating the blood pressure of the patient. So if the blood pressure falls, they immediately give a signal to the blood vessels to vasoconstrict, to the heart to increase the heart rate. Okay, so this is called as the baroreceptor reflex. But this baroreceptor reflex is inhibited by halothane. All right. Then halothane also causes cerebral vasodilation, and amongst all the inhalational agents, it causes maximum rise in intracranial pressure. So if you have a patient who is undergoing neurosurgery, for the same reason, we don't prefer to use halothane. All right. Then the next thing is halothane hepatitis. Now, this is a very important question that comes in the exam. So you should be able to write about halothane hepatitis. So halothane hepatitis is nothing but there is continuous exposure of this particular class of patients. Like there are young obese females who are constantly exposed to halothane, and on constant exposure to halothane, there are some antibodies that are formed, and these antibodies will go and attack the liver, and this will lead to halothane hepatitis. In the end of this chapter, I will take halothane hepatitis in detail for you all, because it is actually a short answer that can come in your exam. So I want you to cover all the points. So I will be discussing that in the end of the chapter. Okay. So that is all about halothane. As I told you, we will avoid halothane in cardiac surgeries. And why? Because it causes arrhythmias. We will avoid halothane in anyone with liver disease also. And why? Because it causes halothane hepatitis. We will avoid halothane in anyone undergoing neurosurgery also, because it causes maximum rise in intracranial pressure. Okay. So that is all the important points about halothane that you need to know. Other than this, as I told you, halothane color of vaporizer is red, and we all know that the MAC of halothane is 0.75. MAC of halothane is 0.75. Okay. Now, the next agent that we need to discuss is isoflurane. All right. So, isoflurane color of vaporizer, as we discussed, is purple, and isoflurane, the MAC is 1.4. In some books, it is given as 1.16, but this is the one that I follow always, 1.4, because as I told you in the mnemonic, it is easy for me to remember also the first two letters. You just take it and you mark dot, 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 and make this as 1.4. Okay. Now, if you look at isoflurane, it is actually an isomer of N-fluorine. Okay. Now, what was the problem with N-fluorine? This just came and went quickly, and this is because N-fluorine was an agent which used to cause epilepsy. N-fluorine was an agent which used to cause epilepsy. Okay. So, because of this issue, N-fluorane was out of fashion, and we came up with the isomer of N-fluorane that is called as isoflurane. Okay. Now, isoflurane, the good point about it is that it causes ischemic preconditioning. It is cerebroprotective in nature, and it maintains the liver blood flow. It maintains the blood flow to the brain during surgery. So there is no ischemia of the brain and the liver. Okay. Bad point is that isoflurane causes something called as coronary steal phenomenon. What is coronary steal phenomenon? So coronary steal phenomenon is also called as reverse Robin Hood phenomenon. Reverse Robin Hood phenomenon. Okay. So if someone asks you to explain coronary steal phenomenon, it is something like this. Now imagine there is an ischemic area that is present in the heart over here. Okay. Now in this ischemic area, you are getting some amount of blood flow. And what we are doing is that ideally, the blood flow in this ischemic area is quite less. Okay. So you have normal area, you have ischemic area. Now you want to direct the normal blood flow towards the ischemic area to prevent further ischemic damage from happening. Okay. But if I expose the heart to isoflurane, then in that case, what happens is that the blood flow from the ischemic area is in fact move towards the normal area. Okay. So there is diversion of blood flow from the ischemic area to the normal area. And this is called as coronary steal. You're stealing from the already poor person, that is the ischemic area of the heart. So this is called as coronary steal or reverse Robin Hood phenomenon. Why is it reverse Robin Hood? Robin Hood used to steal the rich and give the money to the poor. But what you can see over here is they are actually stealing the poor and giving the money to the rich. Okay, so that is called as reverse Robin Hood phenomenon, because you're stealing blood flow from the ischemic area, which is already poor in blood flow, and you're giving it to the normal area. Okay, so this is about isoflurane. Now, I have written over here one point preferred in. So isoflurane used to be preferred for liver surgeries and neurosurgeries. But if you look at the latest books of transplant anesthesia and neuroanesthesia, both of them don't mention isoflurane as the agent of choice. Both of them mention that sevoflurane is now the agent of choice for both of these surgeries. Okay. So sevoflurane, one of the most commonly used agents, it is preferred in so many things. Okay. First of all, most important thing, it is preferred for inhalational induction of anesthesia. Now, this inhalational induction of anesthesia may be either in children or it may be in adults. Okay. So sevoflurane is very sweet smelling, and that is why it is important that we whenever we consider putting an IV line after inducing the patient, then it will be under inhalational induction with sevoflurane. Okay. Then sevoflurane is also preferred in day care surgery. Why? Because it is short acting, it is sweet smelling, it does not cause much of side effects, and the patient wakes up quickly from sevoflurane anesthesia. Ideally, the shortest acting inhalational anesthetic agent that we have, which should be used in daycare, is desflurane. It has quick onset, quick offset, and it is faster in recovery. But desflurane is not preferred in daycare because it has a very pungent odor. It can cause bronchospasm and it can cause a lot of other issues. Okay. Then the next thing is that sevoflurane is now the preferred agent of choice. So I'm adding to this over here. It is now the preferred agent of choice in neurosurgery, and sevoflurane is also the preferred agent of choice in liver surgery. Okay. Some old school anesthetists may mention that isoflurane undergoes least metabolism, and as a result of this, it is preferred in liver surgery. But as per newer guidelines, sevoflurane is the agent of choice for liver surgery. Okay. If you all want to know more about this in detail, I would highly recommend you all to ask Dr. Susan during her liver transplant anesthesia lectures of why they prefer using sevoflurane for liver surgery now. All right. Okay. Now, they say that sevoflurane should be avoided in case of renal failure. Why should it be avoided in case of renal failure? Because as we have studied traditionally, that sevoflurane will react with soda lime or carbon dioxide absorber and lead to the formation of compound A. It will lead to the formation of compound A. All right. And this compound A, as we all know, is nephrotoxic. Now, it is nephrotoxic as per experimental studies in rats, but there are no studies in humans which say that compound A is nephrotoxic in nature. So, as a result of this, it is still something which is debatable. And even if patient has renal failure, we do end up giving sevoflurane to the patient. But whenever there is renal failure, actually the inhalational agent of choice is desflurane. Okay, desflurane produces the least amount of fluoride metabolites which can damage the kidneys, and as a result of this, in case of renal failure, we prefer using desflurane. Okay. Now, compound A, if someone asks you what is the full form of compound A, then you should know that this is the full form of compound A, 2-difluoro, 1-trifluoromethyl vinyl ether. All right. Then color of the vaporizer of sevoflurane is yellow, as we all know, and the MAC of sevoflurane is 2. So these are important points about sevoflurane. Then we have desflurane. Desflurane is one of the agents that we use a lot. Now, desflurane is something which has very fast induction of anesthesia, and the patient also has fast recovery from anesthesia. Okay, so it is something which is quick in onset and it is quick in offset. Now, why is this happening? That is because desflurane has the lowest blood gas partition coefficient. Okay, so we have discussed about blood gas partition coefficient before, and we know that lower the blood gas partition coefficient of an agent, lower is blood gas solubility, or lowest is it blood solubility. Okay, the lesser soluble any agent is in the blood, the lesser it will be, the faster it will act on the brain. Okay, that is because you're able to reach the partial pressures in the lung, high partial pressures in the lung, you're able to reach high partial pressures in the brain quickly if your gas is not very soluble in the blood. So in order to bring about any kind of induction of anesthesia which is quick, and also recovery from anesthesia which is quick, it is important that we have this low blood gas solubility in the agent. Okay, so desflurane has a blood gas solubility of about 0.45. Other than this, if you see, nitrous oxide has a blood gas solubility which is close to desflurane, and that is of 0.47. And actually, if we go for the agent which has the lowest blood gas solubility overall, then it is Xenon. Xenon has a blood gas solubility of about 0.116. But as we all know, Xenon is not a very common agent. Xenon is something which is hardly available for us, and it is very difficult to extract it from the environment. So even though Xenon has the lowest blood gas solubility, we can't use it much. Okay. Then, as I told you before, desflurane has a special vaporizer. The name of this vaporizer is Tech 6. And the bad points about desflurane is that it is very pungent odor. And because of its pungent odor, it causes a lot of irritation to the airway. And it can actually induce asthma in someone who is asthmatic. Okay, so it can cause a bronchospasm. It can cause an asthmatic attack because it is a pungent agent. Okay. Then, just like sevoflurane, desflurane can also react with carbon dioxide absorber. So it reacts, desflurane reacts with carbon dioxide absorber and it can lead to formation of carbon monoxide. We all know that carbon monoxide binds to hemoglobin and it has a large affinity for hemoglobin. And as a result of this, carbon monoxide is not very good for the patient. Okay. Then color of the vaporizer of desflurane is blue. MAC of desflurane, as we all know, is 6. Now let's have a look at why desflurane needs a special vaporizer. Again, this can be asked in your exam and you need to know these 4 points about why desflurane needs a special vaporizer. Okay. So important thing is that desflurane has some unique physical properties. And because of these unique physical properties, it is important that we have a special vaporizer. Now, what is the special vaporizer? It is called as Tech 6. Okay. And what is special about Tech 6? Tech 6 is specifically designed because it uses an electronic heating element. And by using that electronic heating element, you all must have actually seen in desflurane that we have to connect it behind to the we have to connect it to electricity behind and it has to be on. And by using this electrical heating element, we maintain a constant temperature and pressure of desflurane. Okay. Now, why is that important? Because desflurane has a very high vapor pressure. Okay. So in the exam, they can ask you, what do you mean by very high vapor pressure? So desflurane has a vapor pressure of about 669 mm of Hg at room temperature, that is at 20 degrees Celsius. Now, if it has such a high vapor pressure, means it likes to stay in the vapor state. If it likes to stay in the vapor state, that means it is highly volatile agent. Okay. So if it is a highly volatile agent, then your patient will get more and more of desflurane. It is difficult to control the concentration of desflurane. Okay. So it is important that you need to have vaporizers that are designed specifically for desflurane. Okay. Another thing is that desflurane has a very low boiling point. So the boiling point of desflurane is about 22.8 degrees Celsius, which is close to room temperature. Okay. If you use a normal traditional vaporizer like for ISO, Sevo, whatever we use, it cannot accurately give the right concentration of desflurane that you want because your desflurane is so volatile that it always at room temperature wants to get converted from the liquid to the gaseous state. Okay. So this is the reason why we need a special vaporizer for desflurane. Then desflurane is also highly temperature sensitive, and that is why, as I told you, the electronic heating element in Tech 6 vaporizer makes sure there is a constant temperature and pressure. Even slight fluctuations in temperature and pressure of desflurane can change the concentration of desflurane that is being given to the patient. Okay. And as a result of this, you have to have a vaporizer that maintains a consistent temperature. So if you look at desflurane vaporizer, it has a consistent temperature that is maintained, and that consistent temperature helps in accurate delivery of anesthetic concentration, and it does not depend on any temperature fluctuations that are external. Okay. Then you also have to make sure that the desflurane vaporizer does these two important things. Okay. One is it heats the gas and heats the liquid, and second is it pressurizes the liquid anesthetic and maintains a precise control over the concentration of desflurane. Okay. So point number 4 and point number 5 are almost like redundant points. We are mentioning the same thing over and over again. But if they ask you in your exam that overall, why does desflurane need a special vaporizer? It is because it has a high vapor pressure, it vaporizes easily, it has a low boiling point, and it gets converted from liquid to gaseous state very easily. And the third thing is that it is temperature sensitive. So any external changes or fluctuations in temperature can change the state of desflurane. So we need to have a vaporizer that will maintain a consistent temperature and pressure. Okay. So that is all about desflurane. Now, this is a table which gives you the MAC of all the anesthetic agents and the blood gas partition coefficient of each of them. So if you look at nitrous oxide, The blood gas partition coefficient, as I told you, is 0.47. Desflurane is 0.45. This is the lowest blood gas partition coefficient that we have. And if you look at halothane, it has a very high blood gas partition coefficient. So it is slow to act and slower as compared to other agents to act and slower to in offset of action too. This also gives you the MAC of all the agents that we have already discussed. Okay. Now in next class, we will be discussing nitrous oxide, xenon, and some of the older agents like ether, chloroform, cyclopropane. Why did we stop using them? And also we will be discussing halothane hepatitis in detail. Okay. So thank you for joining me today. If you guys have any doubts, then do let me know and I will be happy to take them. Otherwise, we'll complete this class in the next class, that is inhalational agents part 4.